everyone. And first of all, once again, happy Doctors Day. I would say we should always start with looking at the brighter side. COVID 19 has taken a lot of our colleagues. But again, I would see the silver lining in the cloud that this is one disease where the repute of being a doctor, the pride, the respect that was missing in many years has came back. And when it has come back, it has also taken a lot of, I would say, toll, not in the form of health, deaths, but also the mental health, the family. And today, when we are talking about COVID 19 and hygiene, uh, I would just like to start with a little bit of history, already been discussed with my fellow colleagues. We know the history of hygiene. It came from Hygia, the Greek goddess. So if we are doctors and we don't have any medicine, let's think about what do we have in our hands. And I believe we all will say prevention is always better than cure, especially when you don't have any medicine for the cure. And history has bigger lessons, whether it was Typhoid Mary, whether it was Jon Snow. And when it comes to the hygiene part, even in Indian context, the earliest written account of elaborate codes of hygiene were in Manusmriti and Vishnu Puran. So our ancestors were wise enough that we didn't have much of the medicines, but they knew that there are infectious diseases and there are diseases which are directly related to hygiene. Talking about bathing is one of the five nitya karmas in Hinduism, and not performing it leads to sin. So the hygiene, the history, it goes back to centuries. But talking about today's context in COVID 19, why it has become so much important in COVID 19, because earlier also every doctor used to advise common hygiene practices. But in COVID 19, the emphasis is more. Reason being, till now, we don't have any medicines to cure. So if you don't have, you have only one thing, which is prevention. Primary prevention, primordial prevention, and secondary and tertiary prevention. And when we are talking about hygiene, it is one concept which can be incorporated in primordial prevention, primary prevention, even in secondary prevention when the person is sick with COVID 19, and even in tertiary prevention when it comes to the mental health. Now, you can say, why do we need to discuss hygiene? We have vaccines now, but how can a common man can contribute? So everyone in India can help build a COVID-safe India as the restrictions are getting eased out. And how? If everyone just commit that they continue to practice good hygiene at all times to prevent the virus from spreading, I think this is the biggest nation's duty a normal human being, a normal common Indian can do. Because if you have become a link between spread of the virus, then you are not doing your duty. As doctors, it is our primary responsibility to advocate these hygiene practices, because as the lockdown is easing out, people are forgetting masks, people are forgetting their respiratory etiquettes. And that is why the role of hygiene is of paramount importance, because today it is COVID 19, tomorrow it can be COVID 22. These practices will help in mitigating any respiratory or any other infectious disease. So, to simple out, I would say you have to be mad and you will have to do the havoc. And how you would say MA stands for mask. People say we don't have N95 mask. It's enough. Even if you're using a cotton mask, if you're using normal three-layer mask, it is also very effective. It cannot be 95% effective, but it is 80% effective. So you need to wear a mask. Distance, दो गज की दूरी है जरूरी. Distance of 6 feet away from each other. We have to follow these practices, which is now these days missing out. And then havoc. What is havoc? It stands for hands. Then V stands for vaccinated. You need to do vaccination, advocate the vaccine, because this is the only specific protection or primary prevention we have right now. And observe your health daily. Many people are just shying away from their normal daily fever or any rise in temperature or cough or any malaise. They are resistant to get tested. So you have to observe and go for the testing, because again, I would say a stitch in time saves nine. If you get yourself COVID positive detected early, you will be able to save many people from getting infected. And last C stands for cough etiquette. So in my, this mnemonic would follow for all the common people and also for the doctor. So if you want to stop COVID, you have to follow this bad habit. Now coming to this, the most important part after mask is hand wash. After eating, before eating, touching your face, using the restroom, leaving a public place, blowing your nose, coughing, sneezing, handling your mask, changing a diaper, caring for someone sick, touching animal or pets, use, wash your hands. Some people say you will may suffer from OCD also. Yes, it is better to suffer from some OCD than to be a part of this chain of COVID-19 infection. It is a good practice. Now, if there are good habits, smoking is a bad habit. Washing your hands can be a good habit. If you do it, your children will do it. Your family will do it. If you lead by example, your colleagues will do it. Wearing masks, washing hands are such simple protective measures. If the latest study, latest one of the survey done in across Europe, more than 45% of Germans still want to wear the mask, even when the second wave is over, because they understand the only remedy, which is very, very beneficial, cost effective also, is wearing mask, washing your hands. So just these three simple rules: always wear face cover or mask, maintains 2 gauge or 6 feet distance, wash hand regularly, thoroughly with soap and water. I think these rules, and these are advocated by Government of India also. So, बदल कर अपना व्यवहार करें कोरोना पर वार. There are many such slogans. Namaste Corona to stay away from Corona. So now Namaskar is also a very good remedy. But why we should do it? Why we should make social distancing? Why? Because our healthcare system, the second wave was biggest challenge to the healthcare system. If we don't use protective measures, our system, you can see that can cater an n number of cases. But right now, in second wave, we had more than 4 or 5 n numbers of cases because the distancing was not there, mask was not there. So the message is clear for everyone. For college student, you say if there is no social distancing from one case after 6 weeks, there will be 1,000 cases. And if they are using social distancing only from one, there will be 127. So our hospital will not be choked. For even these kind of examples, that different audience, even this is an example of careline where they use the golas, you have to stand like this. For the societies, adolescent and middle-aged, social distancing, you have to follow such kind of mnemonics. This is hygiene. This is your mental hygiene. This is your physical hygiene. This is the real hygiene messages. Social distance champion. It is you're not locked down and elderly. You have just said that message changes with the different society. Even the corporate social responsibility through their slogan has said, yes, do hygiene, do social distancing. So when we're talking about 360 degree of hygiene in COVID-19, it can be personal, it can be social, it can be physical, mental, nutritional, and endocrinological as discussed, and it will be building upon this. When we're talking about personal, we say, yes, it is not only your, I would say, hand wash, taking bath, but it also taking care of your health, observing your health, social distancing, physical. You have to maintain good, rather I would say health, good immunity, and you need to take good immune products, and mental also. In this COVID-19, mental hygiene is one of the things which is rather I would say need to be emphasized a lot, especially those who are taking care of COVID-19 patient and the person who is in kind of an isolation or quarantine because of this COVID-19. People are taking 3 or 4 months to come back to their normal routine. Nutritional hygiene, again, which food to eat. There is, I would say, a bombardment of the news, immunity products, and so many things. But what to take, how to take, when to take is also a part of hygiene. And endocrinological, I think it will build upon taking care of your blood pressure, sugar, so many things included in hygiene. The only thing in the end of 10 minutes, I would say, we should and we need to learn from again the basics. From the time of our ancestor when there were less medicine and more of the principles through which life was lived. And thus I would just like to say those who learn from other mistakes are very wise. Those who learn from their mistakes are considered wise. But those who don't learn from others' or own mistakes will eventually become otherwise. So I think it is a time when emphasis on hygiene, primary, primordial, secondary, and tertiary prevention need to be given so that we can have better equipped for the tertiary, for the third wave of the COVID, and also on any other infectious disease which comes forward in future.